Doctor's appointments can feel so stressful, especially when you've been waiting for answers or juggling symptoms that are already overwhelming. Today I'm sharing with you some simple steps to make your doctor's appointments a little bit easier and a lot more productive so that you can walk out of that office feeling supported and clear on next steps. Hi there, my name is Larissa, and this channel is all about making life a little bit easier after injury, illness, or chronic fatigue. I'm not a doctor, but I am someone who has spent a lot of time in waiting rooms learning what works and what doesn't. Appointments can be overwhelming. The pressure to remember everything, explain your symptoms clearly, and then to process what your doctor is saying to you, it's a lot. It's a lot of output and a lot of input. This is why it helps so much to bring a trusted family member or friend with you. Now, don't roll your eyes because a lot of us have heard that before. Here's the thing. Don't wait until the drive to the doctor's office or the morning of before you bring them up to date and talk things through. Meet ahead of time. Tell them what you're hoping to get out of your doctor's appointment, what the goal is. Review your symptoms together. That way, if you get overwhelmed, if you get flustered, if you forget things, they can step in and help to keep things on track. Even just having someone else in the room can make things feel less stressful. And if no one's available, bring your notes in. Jot down your symptoms, your questions, your concerns, anything you want to be sure to remember. This can be on paper or type notes in your phone, whatever works best for you. And this doesn't mean that you don't know your own health or that your symptoms aren't real. It means that you are in a stressful situation, you know that there's a limited amount of time, and this is your health that you're talking about. It is big and can be scary, and it's really important. So it means that you are cared enough to be prepared, and that is smart. Before your appointment, make a short list. 1 or 2 of the key things you need to get addressed at this meeting. This can be talking about any new or worsening symptoms, or if you need a referral or a new medication. This will help to keep the conversation focused and help your doctor to understand what's most important to you right now. I know it can feel like you've got 40 different things going on. You've got a ton of symptoms and you want your doctor to know that lots of stuff is going on and lots of stuff is not right. That's completely normal. Your health and your body are complex and you want answers. Bringing a list helps to keep you focused without getting flustered. But keep in mind that doctors usually only have a limited amount of time per appointment. So it really can help to flag your top 1 or 2 priorities. Here's an example of how you might communicate that clearly. I have a list of symptoms that I've been experiencing with everything from stomach issues to motor control issues to my balance and mobility and vertigo. I'm happy to run through them. But my main concern today is finding a solution for my migraines. They are debilitating, they are keeping me from functioning, and the medications I am on right now are just not cutting it. This approach can let your doctor know what's most urgent while still acknowledging that there are surrounding issues and give them the opportunity to make connections. If you say, I've got dizziness going on, that's not what you necessarily want them to focus on. Maybe you don't need neurological rehab, you need to get your pain under control. So letting them know that there are multiple things on the table is going to help them help you. If a doctor suggests a treatment plan or decides against something that you were hoping for, it's okay to ask why. Here are some phrases that I found worked for me. Can you explain why this referral or medication isn't a good fit for me right now? What would need to change for this to be an option for me? If this isn't the best recommendation, What other options can we try? When will we reassess? Understanding the reasoning and the next steps can help you feel a little more in control and informed, and makes it easier to follow through and stay aware of what comes next. Guys, medical language can be confusing at the best of times. I have a brain injury, so between brain fog and mental fatigue, some days it's like complete gibberish. If something does not make sense to you, it is okay to ask, can you explain that in simpler terms? I want to make sure I understand that. Can you rephrase it? You deserve to know what's going on with your own health and your own health care. And asking for clarification is a sign of engagement, not weakness. It shows that you care and want to really understand. Medications and therapies often take time, but you're the one living with the symptoms. If something isn't helping, or if the side effects are making your symptoms worse, it's okay to say so. You can always ask, I haven't noticed any improvements. Can we talk about some other options? If they say that they think this is the best option for you, you can ask, okay, if we're continuing with this approach, at what point do we say it's not working and reassess? Sometimes medications take a while to get into your system. Sometimes things are cumulative, and once you get this area calmed down, this area will naturally calm down. So asking for clarification when your doctor sees the big picture is perfectly acceptable. We didn't go to medical school, my friend. We don't know. Here's something that I find difficult with any therapies: vision therapy, speech therapy, any sort of neurological rehab. Sometimes the therapy or the therapist are not the right fit. That's tough because when you're vulnerable and you're working on your health, you build trust and connection, and it feels personal. You can feel dependent on that therapist. But we have to be brutally honest with ourselves. Are they really helping me to move forward? Or am I staying because it's comfortable? Or because I'm in a routine? Or because I don't want to hurt anyone's feelings? It is okay to move on, even when the therapy is not working, especially when it's not working. It doesn't mean that you have failed. It means that you are paying attention to what is effective. Listening to your body can be hard, but you can do it. Sometimes after doing everything right, a provider is not the right fit for your needs. And yes, wait lists can feel impossible, but here's how I look at it. Waiting 6 months to see a specialist who understands what is going on with your condition and can actually help is better than spending 6 months working with a therapist who doesn't help. Your time, your energy, and your money are too valuable to waste. You are allowed to ask for a second opinion, request a different provider, seek out a new clinic or a new specialist. Call a patient advocate if you need help. Going to the doctor does not have to be overwhelming. A little preparation, whether it's a friend by your side or pre-planned notes, or just the confidence to ask the right questions, can make all the difference. I hope that you'll share in the comments what's something that you have done that has made doctor's appointments easier for you. If this was helpful, please like, subscribe, or maybe share it with someone who needs a little bit of a confidence boost before their next doctor's visit. Thank you so much for sticking with me. I appreciate it. And please remember that you are not alone trying to figure out how to make healthcare work a little better for you.